Hello everybody, welcome back to the series on how to read CT phase. So basically in this part we will focus on the most important and commonly missed injuries, which is frontal sinus fracture or frontal bone fracture. Now the problem is many times this fracture looks very subtle on CT, but if you miss it can lead to various types of problems like CSF leak. There can be intracranial injury or frontal sinus involvement can be there. So today I'll show you step by step how to approach or how to identify the frontal bone fracture on CT in a way that that you will never miss it again. Okay. Now, if you talk about the etiology, so motor vehicle accident is most common etiology, followed by high impact sports related injury. Clinically, what all are you going to see in that trauma patient? So you will see the gross depression upon the frontal area of the skull, or laceration over the supraorbital ridge, glabella, lower forehead, which is most common finding on the clinical exam. Since we know that suppose this is the orbit and we know roof of the orbit is made up by frontal bone, so if any kind of injury or trauma which is there in the frontal bone, so there are very high chance that the orbit might get involved. Okay, so if it is there, so you should always consult an ophthalmologist. Now, if you classify the frontal bone fracture into on the basis of location, so we know that frontal sinus has got two tables, or frontal bone has got two tables. One is anterior table and posterior table. So if any kind of fracture, is there, so there can be fracture of both the tables, or there can be fracture of only anterior table and only posterior table. Although isolated posterior table fracture is very rare. Okay, but isolated anterior fracture table is very common. Okay, now relevant anatomy. We know frontal sinus first appears at the age of 6 to 8 years and fully pneumatized in adolescence. Okay, this is the draining system. So as we know, frontal sinus, how it will drain. So there is a duct which is known as nasofrontal duct. So the drainage starts from frontal sinus, then it goes via nasofrontal duct or frontonasal duct to infundibulum part. Okay, infundibulum. Then it goes at the area of hiatus semilunaris. Okay. Then finally, it drains into middle meatus. If any kind of trauma, if this duct gets damaged or fractured, then there can be blockage of this duct. So in that case, it can lead to chronic drainage complication. Okay. Now we know frontal sinus is close to dura, frontal lobe, crista galli, and cribriform plate. So if any kind of fracture of the posterior table, look in this picture. This is the abnormal side. Okay, this is the normal side. Now, first we will see the normal side. This is the anterior table. This is the posterior table. Okay, this is intact anterior table and intact posterior table. We can see the jet black area, which is the sinus area. Now, look at this part. Here, look at this area. This is also frontal sinus area. Okay. Now, we can see the anterior table. We can see the posterior table. We can see the fractured anterior table, but posterior table is intact. So there is collection of blood. Can you see the haziness in this area? This area and this area is jet black. So this is air and this is blood due to fracture of the anterior table. Okay. Now look in this case. Here what we can observe, we can see the fracture of both the table. First fracture is there, which is in the anterior table, and this is the fracture of the posterior table. So in this case, the dura is not intact. So we can see the black area in the brain matter. So this is air, which is air inside brain, which is known as pneumocephalus. Okay, pneumocephalus. Okay. Now, so there are various indications. We cannot operate every frontal bone fracture patient. So there are some indications. What are those? So if there is depression of the anterior table, or if there is depression of the skull, so there will be cosmetic deformity. So in that case, you will operate. If there is CSF leak, okay, if there is involvement of both the table, so in that case, you should operate. Okay. There are various complications can be associated with the frontal bone fracture. There can be frontal sinusitis. Okay. There can be meningitis, osteomyelitis, and so on. Late complications we can I have mucocele, mucopyocele, and delayed CSF leak.